Everybody, my name is Julia Albright, and I've been asked to take over Facebook Live. I hope I'm doing this right. I have to admit I've never done it before, but I am an associate professor over in the College of Veterinary Medicine. I'm also a two-time alum. I have a master's degree in experimental psychology from the psychology department in arts and science, and then I got my veterinary degree from the College of Veterinary Medicine as well. I went on to specialize in veterinary behavior. You may be asking yourself what in the world a veterinary behaviorist is. We are sort of akin to psychiatrists. If PhDs are psychologists, we would be the psychiatrist, and we came about because there was a need to understand more in the veterinary patients about how the body and mind are connected. We know that stress very much affects the body, and body can affect stress and behavior. So the point of today is to primarily take your questions. So we'll see if anybody, please feel free to post questions. Again, I hope that I can see there how to get some questions, but happy to, yeah, if you guys have any questions about your pet's behavior, I'm happy to answer them for you now, but I can talk a little bit more about COVID. A lot of people have questions about how COVID and the pandemic and staying at home may affect behavior when people start going back to work. What the advice I give to folks is don't freak out about it. If your dog did not have, and I should back up and say that dogs are most likely to present to us for separation related issues, meaning destruction or vocalization, urinating or defecating in the house when you're gone. So those are some of the signs of separation anxiety or separation related distress. But that doesn't mean that cats don't get it. They just tend to not make quite as much of a mess, so people don't come to see us for it quite as much. But if you have the suspicion that your cat seems upset when you're gone, you may be onto something. So, things you can do to prevent it. Well, the problem is we don't actually know what causes separation anxiety. If you have a dog that, a year or two ago, or even way back when it was a puppy, it had some issues with separation anxiety, it may be prone to that. But if your dog or cat has never had a problem with that before, I would not panic about it. But you may start, leaving the house a little bit now. I bet most of you are doing that some. But also, pairing it with something good. So if it's safe, you don't have food aggression between the dogs in your home or anything, giving it something like a long-lasting toy, like one of those Kong toys stuffed with a little bit of peanut butter while you go, just to help it look forward to these departures. So I see some questions here. So one is, I'd love to hear your thoughts on how pets pick up on our anxiety and changes in routine. There's actually some researchers that have been studying that. And for the most part, our animals, I think, are very empathetic, or at least they can pick up on our changes. And what's so interesting is we're such a visual species that we see body language changes, things like that tell us that our dog or cat or horse or bird or hedgehog, whatever it is maybe not feeling the same, feeling quite right. But we have to remember our animals may be picking up on, smells, sounds, sounds in our voices that might let us know. So the bottom line is, as a veterinarian, I really try to make sure we're practicing evidence-based medicine. And there's a few studies that may show that some people that maybe cling to their pets a little bit more may cause some behavior problems in their pet. But lots of pets have anxiety problems, and their owners do not. So don't think that, I don't want anybody to blame themselves for their animal's behavior problem, which may be a little bit different than what you've heard before. Some TV dog trainers, I hear that a lot, that, there's no bad dogs, only bad owners. And I want to discourage that a little bit. There's lots of things that cause unwanted behaviors, especially when they're aggression and anxiety based. There's lots of things we as owners can do to try to improve them, but there's no reason to give yourself a guilt trip over it. So other questions, what can we do for our pets when we leave during the day now, that we may go back to work soon? So I tried to address that just a second ago. So practice little departures, but I would really encourage you, instead of just doing it over and over again to hope that your animal gets used to it, do your departure routine, but also give the animal something that maybe he doesn't get any other time, or it's really good. He may get a Kong with it's dog food in it, but when you leave, he gets a Kong with peanut butter in it. Just something to help. It's not just distraction. It is to some extent distracting them and giving them something else to focus on while you're gone. But also they pair those two things. So you leaving, they might say, oh, where's my Kong? I'm excited about that. So it just helps improve the emotional association between something he doesn't like and something he does like. So let's make sure I'm doing this. So somebody recommended, somebody asked, would you recommend Adaptil spray? So I saw it on a commercial the other day. That is an excellent question. So Adaptil, for those of you who don't know, Adaptil is the dog, it's a synthetic analog of a lactating female pheromone. So pheromones are chemical communications between animals. And back at the beginning of this, I mentioned that, we're a very visual species. So we pick up on body language that might tell us that somebody's in trouble or somebody's stressed out. I have to admit, my son is standing right here speaking of body language. Something about please don't bother mommy for 30 minutes means please come ask me if I can have a snack 5 minutes later. So anyway, back to the pheromones. So this company has created a synthetic version of the lactating female dog pheromone, and that's marketed as Adaptil. The cheek, for cat owners out there, the cheek gland contains several different fractions from their sebaceous glands there that may have both a calming and a communication signal, and that is called feel away, if you've ever heard of that. So does it work? I think that it can be a layer, but if your animal has a pretty severe anxiety issue, I think that we should talk to your veterinarian, first of all, to make sure that there's not a medical reason that might be contributing to it, but also discuss if stronger medications or supplements may be worth it. But I've certainly had some folks report back that they thought that that was an effective layer, or they thought it did do something. So the good thing about it is there's very few side effects with that. You're not putting it into the animal. I've heard of 1 or 2 cases throughout my 15 years or so of doing this that the animals seem to have a negative reaction to it. So I can't say it's side effect free, but it is a very, very low risk intervention or therapy. So great question. Somebody asked, I got a puppy. So pandemic puppies were quite popular. And so somebody said, we're afraid that we might be, we're around it all the time now. What can we do to make sure that we don't, we haven't induced separation anxiety? Same thing, make sure that you spend the puppy is spending some time alone, or at least away from you. It could be spending some time with its buddy, though, another canine buddy, and that you pair it with something good. That may be where the Adaptil comes in as well, that pheromone spray. One other thing about puppies I wanted to mention is, so for those of you that maybe did get a pandemic puppy, please remember these dates, 4 to 14 weeks. So that is the time when your dog's brain, approximately, those aren't set in stone, but approximately that's when your dog needs to be socialized. So that means that it needs to get used to kids and cats and delivery men and bikes. If you want that dog to be friendly towards them, or reduce the risk, I should say. There's no guarantees out there, right? But reduce the risk of them being fearful of it because I haven't seen it before. So even if you got a puppy and you're not feeling like you can go to puppy classes, that you should definitely get that dog out there. Don't just get it out and expose it to scary stuff. Same thing. Pair it with, maybe leave some bags of treats out where a stranger, toss some bags of treats. So if you pass a neighbor, maybe they could toss your puppy a treat because you want the puppy to look forward to meeting new people. I'm not sure I got a specific question about that, but I did want to mention that socialization is not really, so if you got an adult dog during the pandemic and it's frightened, let's say, of other dogs, don't be tempted just to go to the dog park and let it run around with other dogs and think that that's actually a form of socialization. What we want to do in an adult dog, or a dog past that 3-month, 4-month phase, is actually kind of actively teach it that being around other dogs or kids or whatever it seems to be fearful of is a good thing. So that's where you might get a behavior specialist involved to make sure you're doing that right and you're not setting your dog up to get even more scared, learn more negative associations. So other questions here. Somebody asked, so again, about my dog has become clingy, especially the older one. Lots of questions to ask about that, but things that come to mind just based on that are older dog. So dogs get, we call it cognitive dysfunction, but if we were to look in the brains of these dogs and cats, that start showing signs of dementia, essentially. That they have a very similar pathology to humans with Alzheimer's. So you see kind of the same beta amyloid plaques, and they can cause disorientation. They can cause the animal to actually, I would say clingy is more common than separating themselves, but that's possible as well, that they just really kind of don't want to be around the family anymore. But getting stuck in corners, maybe a loss of house training. Sleep-wake cycle is a huge one that brings people into us. If you got an older dog that's keeping you up awake at night, there are some things we can do to kind of help that just like with people, there's no cure for Alzheimer's, but there's a few things we can do to improve quality of life. But separation anxiety or clinginess to you can be a sign of cognitive dysfunction as well, or kind of doggy Alzheimer's. So something to watch out for, something to talk to your veterinarian about. But it may be, something you could do proactively. I kind of sound like a broken record at this point, but maybe a good idea to actually have your dog spend a little bit of time, not sitting right on your lap, not snuggled up to you on the couch 24/7. But maybe sit on a dog bed across the room, or maybe if you're working in your home office like I am, you just have a baby gate across the door, so they have to go separate themselves a little bit. And again, I'm not a fan of just doing that tough love, but actually pairing it with something that they really do like. And really the only thing that competes is usually a tasty food. Again, talk to your veterinarian, make sure you know exactly how much you can be given. to that dog, because we don't want anybody to gain weight. Dogs can definitely get put on that COVID-15 just like we can. So what other questions here? Somebody asked, what about products for the FDA? So I'm a little hesitant to kind of talk about therapies. I want everybody to make sure that they're talking to their veterinarian about what is right for your dog. But know that there are a lot of options out there. There's everything from, we talked about kind of the low intensity, kind of the low guns in our arsenal. So that could be like the pheromones, that could be you might have seen pressure wraps. A couple of brands are like the Thunder Shirt, the anxiety wrap. That pressure can be calming to some animals. Do not panic if your animal is not one that responds to that. Just means that we need something a little stronger. There's a couple of good veterinary products out there that are made of all natural products, and that's everything from green tea extract to a milk casein. I am not going to talk about CBD, so don't ask me any questions about that. There's so much legal issue. It might work. I want you to talk to your veterinarian to make sure that that's a good product and good product for your dog, I should say. But other things out there, there's tryptophan. So if you want to explore some of those more natural options that, again, have very low side effect, that there's some good products out there. Be very careful about just going online and saying, oh, I heard Dr. Albright say something about green tea extract. Let me just Google it and pick a product. So nobody is really looking at the quality of those products. What's on the label is not necessarily what's on the product. Just be careful about that, and that's why we only recommend the veterinary brands. They might cost you a little bit more, but they stick by their products. There's a new one out there, it's really interesting. That's a calming probiotic. It's from the company Purina. But then we absolutely have medications for things like separation anxiety. And in fact, separation anxiety has 2 FDA approved medications for it. So you can talk to your vet to see which one is right. So those medications, some of them the animal takes every day no matter what. And some of them you can add on just right before you leave to kind of a booster. But just remember all of those sort of, they help the animal learn, they help the animal cope, but we really want to do some behavior modification with a qualified professional, and that's a whole nother talk there. Just remember that anybody can hang out a shingle and say they're a dog trainer and even a behaviorist. So you need to do your due diligence to make sure that this person's actually qualified, not just to teach obedience, but it's kind of like your basketball trainer versus your school counselor. Your kid's basketball coach is not really qualified to help with their emotional issues. Not every dog trainer, and I should say that I qualify with that. There's some really excellent dog trainers that are well educated and good at this, but it's difficult for you as a consumer to know that. So buyer beware out there for your dog behavior professional help out there. So so there are things that we can add on. Let me see what other questions we got here. So somebody in Texas is asking about a fellow employee of my husband was admitted to the ICU with COVID, and her Maine Coon cat, great question, contracted COVID. She's recovered, but the cat actually passed away from it. How susceptible are our pets to the virus? That's a great question. I fully admit, as a behaviorist, I'm not an infectious disease expert. So I say this with a little bit of caution. Great resources if you go to the AVMA website. So the American Veterinary Medical Association has kind of a COVID response section about COVID and pets. So that's probably the most up-to-date information. But what I do know is that cats in particular, of our common pets, are susceptible to to being infected and showing clinical signs. There is almost no data to say that we could get it from the cat. So please don't go out and give away your cats because you think you might be susceptible to it. That really just does not seem to be an issue. But again, your veterinarian is a great resource for this, as is the American Veterinary Medical Association, AVMA. I believe it's .org website. Let's see if we've got anything else here. So far, I think we've gotten all the questions, unless I'm not scrolling down far enough. All right, well, thanks everybody for joining. I'll maybe stick on here just a little bit longer in case anybody else has some questions. But if you're interested in learning more about, if this is the first time you've heard about a veterinary behaviorist, you can go to our college, our specialty college website, which is DACVB, so Diplomates of the American College of Veterinary Behaviorists, DACVB.org. And you can find a veterinary behaviorist that may live in your area. There are not very many of us, probably less than 100 or so in this country. So we do a whole lot of collaboration and consulting with your veterinarians as well. So I think we got another question. So yeah, the person who asked about the kitty that passed away from COVID, I think that, should we be worried about our cats and giving it to them? Again, I think that's a very individual question, and how much of a lifestyle you're leading that you may contract it and give it to your cats. But certainly your home is probably the best place for your cat. So talk to your veterinarian, but I don't think I would run out and be rehoming your cats because of your lifestyle. I got one last question, or one other question, about what's a good way to introduce new pets to the family. So it depends a little bit on the species. So let's stick with dogs and cats. If anybody wants to talk about birds or rabbits or something like that, maybe we could do that offline. You can certainly find my email in the UTK directory or on the UTCBM website. But introducing dogs, so remember that dogs are, I wouldn't say intrinsically a group species. They are group animals. They do enjoy living with groups, but the reason I'm hesitating here is just because you have two dogs that you would like to be friends doesn't mean that they are necessarily going to be friends. So just like, your neighbor kid, it would be great if they could go play together, does not mean that those two kids are necessarily going to like each other very much. Same thing with dogs and cats. So especially if you have a history or you're worried a little bit, a history of a little bit of aggression between dogs, best way that we found to introduce dogs is A, go to a neutral space. 2, let's do some leash walking because nose to nose, bum to nose, nose to bum, that's not always well received by both dogs. So having the leash on, try not to choke up on it, but a loose leash. Start kind of across the street from each other, and as long as everything's going well, you can make your paths kind of converge as you keep walking. That's a little bit less threatening to have the dogs sidle up together. Continue on with the walk, and then again, based on kind of those dogs, you can decide, well, is it a good idea to go ahead and have them come in? Should we go to the backyard first and let them run around? Maybe go to the backyard, drop the leashes, but don't take them off, just in case there was a problem. You could quickly separate them. New dogs are always going to have some resource guarding at first while they're checking each other out, even on the best circumstances. I shouldn't say always, but it is not uncommon, and we shouldn't panic, but that does mean don't group feed, don't throw everybody a bone, don't give everybody toys at the same time, separate them until you know how they're going to do with each other until they get to know each other a little bit too. And if problems continue, you need to talk to a qualified behaviorist. Cats are we have a kind of a similar protocol that please don't dump the cats together and just hope it works out, because there's actually a study on this, and you have a 50-50 chance that it's going to go pretty badly, so badly that you might feel like you need to rehome that other cat. So what we typically do is put the new cat in its own, and cats in particular don't do great with change. So we need to slowly, way more slowly than we would even a dog, kind of integrate them into the home. Giving them their own spot with their own enrichment, meaning their own toys, that litter box, food, all of that in that room, so they really don't have to leave. After a few days, maybe even up to 2 weeks, depending on how stressed out everybody is. You might do something like open the door, but have a baby gate. And some people just kind of let the cat smell. I would encourage you, just like we were talking about before with pairing your absence for dogs with separation anxiety with something good, pair the cats seeing each other with something good. So when you open the door to let them see each other, don't let them necessarily sniff each other. Open the door and let them eat their favorite treat together for a couple of seconds and shut the door. I should mention too, because smell is so important. With cats, one thing we often do is kind of rub one cat with a towel, introduce it to the other cat, rub that cat, kind of switch that towel back and forth. And that kind of gives you, if they're hissing at the towel, that kind of gives you an indication. I don't think they're ready to meet in person yet. So once you're kind of feeding them the treats far apart, you can kind of slowly move that together, as long as there's no hissing and spitting at each other. And then kind of let them sniff each other. So the bottom line is with cats, really slow down, give them tons of opportunity, help them form that good association together. Please don't just dump them together and hope it's going to go well. So great questions. Somebody asked, are there questions we haven't asked that you often get in your practice? Well, I have to say most people come to us already with a question and a problem. So the most common things we treat are canine aggression is by far the most common thing we see. And then things like separation anxiety, general noise phobia, 4th of July was just here. Dogs notoriously, dogs and cats do pretty poorly with fireworks. It's probably our least favorite time of the year over at the vet school. So we can help with medications and calming strategies for those dogs. And then on the cat side, soiling outside the litter box and then aggression are pretty common questions for them as well. Those are the common things we treat. I'm personally, I don't do a lot clinically with horses anymore, but stereotypies and OCD type behaviors, which we treat in cats and dogs as well. We work with in horses too, and birds. So now you know kind of the day in the life of a veterinary behaviorist. Looks like we've been going on about half an hour here. Again, I'm glad to stay on if you've got any more questions, but happy to let you guys get on with your evening as well. Well, evening here on the East Coast. All right, well, it looks like we had a good crowd here, so thanks for joining. Have a great day.